Okay, hi Camille, it's Dr. Buford. We're just getting started on your left knee. We're looking in the medial compartment. This is the inside of the knee. And like we talked about, we always confirm that everything looks good, even though we have an idea where the problem is. So the meniscus is over here. It's this structure just below my shaver. There's water flowing through the knee at all times, and so that's why you'll see things move. It's basically underwater. As we look at the posterior horn of the meniscus, there's a good shot of the posterior horn. And that looks really good. So I don't think we're going to mess with that. I'm going to keep looking for a little bit, but that looks really good. Pause, please. Okay, this is the central part of the knee. This is your anterior cruciate ligament just behind the shaver. We tested your knee before we started and confirmed that it was stable, and we can see why that ACL could not look better. It looks really good. Your posterior cruciate ligament's actually behind this little fat pad here, and it runs down through that region of the knee towards the back. So ACL and PCL both look pretty good. And in just a minute, we're going to change your knee position and have a look at the lateral compartment. This is a little bit of ligamentum that's normal. We haven't yet seen the trochlea where the little injury to the cartilage is yet. We'll show you that probably last, possibly. This is now the lateral compartment. And I'll tell you what, Camilla, this looks like it's out of a textbook. Couldn't look better. Don't see any significant injury to the cartilage or the meniscus here. That just looks like normal anatomy. Nonetheless, we always inspect and have a look to make sure that we're not missing something subtle. And that looks pretty good. Pause, please. Okay, so we're looking at the trochlea. Let me just give you an orientation here. This is the medial side. This is kind of the central part. As we follow down to the front of the knee, you can kind of see how that works. And then the lateral side is over here. And this is the area we're talking. See how that's loose all in here? This is where it's not normal, right below my shaver there. See over here, it's nice and smooth and white. And then right about here, you can see where it's cracked and doesn't quite look so good. So we're going to do our best to try and create some blood supply here and stimulate it so it seals over a little bit better than it has. But I think we're getting a good look at it right there. Now, as we look up at the patella, at your kneecap, we'll just see if there's anything here. And we looked before, I didn't really see any patellar lesions that were corresponding, and that looks pretty good all the way over to the lateral facet. So, okay, pause please. Okay, so we've got our first pick in, and we're just trying to clear the picture up and flush a bunch of water through. What we're going to do is start at the edges of the defect, about like that. And then we take a little mallet, just tap that down into the bone. Okay, so there's one. Another hole right at the edge right here. We'll look up here a little bit. This is kind of the superior extent. Right here. This is kind of the superior extent. defect here. Not wanting to leave anything loose. I think that's pretty much got it. Back with our picks in just a second here. Okay, we made a bunch of holes in the defect here. You can kind of see some of them. And we'll hope that that seals over. We're going to put our shaver back in and see about making sure there's no loose pieces or anything else to worry about. But I think this will be the end of the video unless we see something else to worry about. But I think we'll get you back to the recovery room in just a few minutes. Good luck to you now. Bye-bye.